Hello everyone, my name is Bethany and this is my sister, and she's graciously allowed me to perform an assessment on her today. We'll be doing the heart and lung assessment along with the peripheral vascular system, looking at pulses and the overall health of the heart and lungs. A couple of disclaimers: I will not be exposing any of her skin today. This is just a demonstration assessment video. However, in the hospital or when assessing patients, it is important to put the stethoscope on actual skin for the best assessment. So just to begin, I've already done my hand hygiene. We'll start with a few questions. I'm going to ask her a few questions. So how did you sleep last night? Did you sleep good?
Very good.
So she had a good sleep. Have you ever felt short of breath?
Yes.
Yeah? But do you feel short of breath on a regular basis?
No.
No. Have you ever had chest pain, or do you deal with that on a regular basis?
No.
No, she hasn't had chest pain. How about any lung diseases? Do you currently have any lung diseases?
Not currently, but I've had pneumonia in the past.
Yeah, so she doesn't have any long-term diseases like asthma or COPD or anything like that, but one time she did have pneumonia. Do you smoke?
No.
No, she doesn't smoke. Does anyone else in your household smoke?
No.
No, we're good here. Thankfully, no one in the house or outside the house smokes. So that's a good thing especially for lung health and overall body health. Is not having to be around smoke or smoking, of course, yourself. That's pretty much it as far as diseases. Have you had any heart disease, or do you have coronary artery disease or anything like that? That can affect the peripheral vascular system as well. So now we'll go ahead and get started on our assessment. The first thing we're going to look at is the lung sounds. So I'm going to begin with the back and work our way towards the front. And we're also going to be looking at seeing if there's any tactile fremitus in the back or the front of the lungs, in the anterior or posterior part. So we're going to look at the posterior part first. All right, take a deep breath for me. Good. And again. Good. Another time. And again. One more time. And one more time. Good. Now we're going to check for the tactile fremitus. So just go ahead and say 99.
99.
Okay, and again.
99.
And again.
99.
All right, so all the lung sounds sound clear in the back, and you can't hear any vibrations, which would mean there would be tactile fremitus. Now we're going to go ahead and assess the lung sounds in the anterior portion. I'm going to turn around. All right. And again, normally you would listen to lung sounds on bare skin, but we're not doing that just for the point of demonstration today. All right, now if you can take a deep breath. Let it out, good. And again. And again. Good. And two more times. Good. One more time. Good. Now if you observe, you can see that her respirations are even and unlabored, and all of her lung sounds were clear bilaterally. Something else that is important to listen for is the carotid arteries in your neck. You don't want them to be partially occluded. You don't want to hear bruise or any swishing sounds. You just want it to sound like a heartbeat. So for that, we use the bell of the stethoscope. So I'm going to go ahead and listen to her carotid arteries. So there's no swishing sound, and that's a good thing. The next thing we want to look at is listen to the heart sounds, listening to the different valves. So we have several different valves. The first one we're going to listen to, we find it on the left sternal border on the second intercostal space, and that's listening to the aortic valve. The second one we're going to listen to is the pulmonic valve, and you find that on the second intercostal space as well, but on the right left side of the sternal border. Next, on the third intercostal space, we are going to listen to Erb's point, which is also where you will hear your point of maximum impulse. Then the fourth intercostal space is where you'll hear the tricuspid valve. And the fifth intercostal space on the midclavicular line is where you'll hear the mitral valve. And sometimes it can be hard to hear, so if you have the patient sit forward a little bit, and you use the bell of your stethoscope, you can hear it a lot better. It helps to bring the heart closer and out front. Alrighty, so all the heart valve sounds sound good, and you can't hear any murmurs. So the last thing we need to look at is the pulses. There's several pulses. The ones we start out with is the temporal pulse, and you don't want to feel them together, just one at a time. And same with the carotids, one at a time. The next pulse you want to feel is for the brachial pulse. And then the radial pulses, and it's good to feel those at the same time to feel for the equalness of the pulse. And while you're doing that, you can look at the skin. You want to see that it's warm and not too moist or too dry. You want to look at the coloration. It should be a pink color or normal for that person's ethnicity. Also, you can look at their lips, and you can see that her lips are pink. There's no blueness in her fingers. That's a good sign of good oxygenation. Another thing you can check is skin turgor here or by the neck, and it should be elastic. It should go right back after you pinch it up. Then at the fingertips, you can look for clubbing. People that have lung diseases and different things will have clubbing. The angle of their nail bed will be changed from long-term loss of oxygen or having poor oxygenation for a long time. So you can also check cap refill, which is where you push the nail down, and when you let it go, the blood should come right back really fast within 3 seconds. If it does not, then that's also a poor sign of oxygenation. The rest of the pulses, we'll check. Just have you lay down here for a moment. We've got the femoral pulses, and then we've got the popliteal pulses, which you feel underneath the knee. And then we've got the posterior tibial pulse. And we've got the dorsalis pedis pulses. Now sometimes, specifically on older patients, it's harder to find that pulse or feel it really well. And one thing that can be used is a Doppler to see how those pulses are. It's also good to check cap refill in the toes and see if that comes back with less than 3 seconds. Okay, you can go ahead and sit up now. So that pretty much concludes our assessment for today. It's important to look at all the different parts of the body and see how the heart and lungs are doing, and you can tell just by the skin and the nails and everything, even without necessarily listening, if someone has really good oxygenation and perfusion or not. So that concludes our assessment today. Thank you everyone for watching, and thank you for allowing me to assess you.